Hello dear friends, now let's discuss on the third part of our introductory video series on the PLAB 2 exam. And on the third part of our video, we have to discuss about how to know the type and format of the station and how to identify the task. If you haven't seen the first and the second part of our introductory video, I request you to go first of all into those two videos, which are also linked below in the video description. Okay, now the third chapter is about knowing the type and format of the stations. It is very important. Dear friends, there are 6 different categories of the PLAB 2 stations and you have to know what are the type and what are the format. And you should also identify this from outside the cubicle. Okay, now you will have 90 seconds outside the cubicle to plan and you will have 8 minutes inside the cubicle to perform. Okay, now what you will do in that 90 seconds, there are a lot of things you need to do in those 90 seconds. One of the important thing is to also identify the task properly. Dear friends, if you are not able to identify the task properly, I will guarantee that inside the cubicle in those 8 minutes, you will definitely have a very hard time in the time management. So in fact, the battle of 8 minutes is won if you do the proper planning in those 90 seconds outside the cubicle. Okay, now let's discuss into this how to know the type and how to identify the task. So like I have said, there are 6 different categories. They are history-based station, counseling-based station, ethical-based station, combined examination, in which you have to actually perform the examination to the patient or to the mannequin depending upon the situation, and it is called combined because you also have to do the history taking as well as the management apart from doing the examination, therefore it's the name combined. And finally, there is teaching based station and SIMMAN based station as well. In the teaching based station, you have to actually do the teaching to either a FY1 colleague or a final year medical student or the nurse. Okay, and we have a SIMMAN. I will let you know what exactly the SIMMAN is, and I'll also discuss how to identify the SIMMAN based station. Now, how to identify the history based station? First of all, there is a symptom in the task. For example, 27-year-old female has presented with some headache. Okay, or sometimes they will not give the symptom and will just say that has some problem kind of phrases. Okay, for example, 50-year-old male presented with some problem. Okay, whenever you see the phrases like this or a symptom in the task, that is most probably the history based station. What is the advantage of identifying this as a history based station? The main advantage, dear friend, is now this way you can know that you have to invest your 5 to 6 minutes of your time in history taking and 2 to 3 minutes of your time in the management. Why longer time in the history taking? Because you have the symptom. That means you have to ask proper questions so that you can get the correct diagnosis. And if you can get the correct diagnosis, the 2 minutes or 3 minutes of your time will be enough to do the proper management in this kind of patient. Okay, so this is the advantage. The other category is the counseling based station. In the counseling based station, you will either see a name of a drug, a name of a disease, a name of a procedure, a blood report, or sometime usually long task. Okay, for example, they will say a patient has a myocardial infarction and is on aspirin, clopidogrel, atorvastatin, etc. Okay, now what you have to do is in such case you have to identify correctly that this can be a counseling based station and you have to act accordingly. Sometimes you will see a name of a disease, 53-year-old female presented with diabetic retinopathy. Okay, sometimes you will see a name of a procedure, colonoscopy has been planned in this patient. Okay, sometimes you will see the whole lab report. You will see the hemoglobin, total count, differential count, liver function test, kidney function test. Okay, sometimes thyroid function test, etc. So if you will see the blood report, most probably that is a counseling based station. And sometimes if you see the whole page of the task filled with some different informations, then most probably that is a counseling based station. Dear friends, what is the advantage of identifying this as a counseling based station? The advantage is now you can invest your 4 to 5 minutes of your time in the history taking and 3 to 4 minutes of your time in the management. Why a bit longer time than in the history taking in the management portion? Because here you have to do a lot of things, some time to educate the patient, some time to convince the patient, okay, some time to teach the patient. Okay, in a nutshell, you have to do the counseling. Okay, and therefore you will require a bit more time in the management part. So that's all about counseling based station. The third category is the ethical based station. Here it looks almost similar like a counseling based station, but at the end, in the special note, you will hear the phrases like patient is angry, the cannula has not been changed, please break the news, patient does not want the treatment, there is a sign of domestic violence in the task itself. Sometimes you will say confidentiality has not been signed, consent has not been signed. Sometimes it says disclose the error or disclose the information. Okay, so this kind of ethical dilemmas on the special note will let you know that these are ethical based station. These are ethical based station. Dear friends, what is the advantage? The advantage is now you can invest less than 4 minutes of your time in the history taking and more than 4 minutes of your time in the management part. Okay, now why more time in the management part? Because here you have to do a lot of things. For example, you have to counsel the patient. Okay, you have to also talk about the incident form most of the time. Okay, most of the time you have to escalate this matter to the concerned senior authority. Okay, sometimes you have to talk about PALS and things like that, and therefore it will require more time in the management part. Okay, now see, the main purpose of taking history in the history based station is to maybe get a correct diagnosis or sometime to rule out the red flag symptoms. Okay, similarly in the counseling based, you want to take the history to understand the condition better, for yourself to be in the better position to address the concern. Whereas in ethical based station, most of the time the task is very clear and the only purpose sometimes might just be to build a rapport. Okay, now what do I mean by that? I mean that, for example, if it is about breaking bad news, you have to take the history. You cannot directly jump into the bad news part. Therefore, your history taking is mostly just to build a rapport. So, your purpose of history taking in these three stations will also differ. And that is also the advantage of knowing the task beforehand outside the cubicle. Let's go into the fourth category, in which we'll be discussing the combined examination scenario. In the combined examination, there it says about perform relevant examination in the task. If it says perform relevant examinations, it's very easy. This is the combined examination scenario. Sometimes they will just say assess the patient. Now how to understand this assess means to actually examine, because you will see this word assess in history part, in the counseling part, or in the ethical based station as well. So how to understand this assessment means to actually examine the patient. You can get the various clues. For example, you will see the patient in the couch. You will see the patient wearing a hospital gown. You will see some instruments on the table. Sometimes you will see the mannequin inside the cubicle. So these are the clues. Therefore, make sure that you are properly scanning the environment inside the cubicle as well. That is also providing you the clues of the task. Now, what is the advantage of identifying it as a combined examination? First of all, you will not miss examining this patient. Number one, that is the biggest advantage. Number two, the time management will also be easy. You have to invest 2 to 3 minutes in the history taking, 2 to 3 minutes in actually doing the examination, and less than 2 minutes in the management part. Sometimes you can go up to 4 minutes in the examination part. Let's discuss about teaching based station now. In the teaching based station, you will see the phrases like demonstrate and teach. Okay, and it will say further things like FY1 wants to learn, medical student wants to learn, or nurse wants to learn. So these kind of further clues will also be there in the task. Inside the cubicle, you will see a young man or a woman with the NHS card, or sometimes the nurse in that blue dress. So this will also let you know that this is a teaching based station. Now dear friends, what is the advantage of knowing that this is a teaching based station? The biggest advantage is now you know that your main job is to not complete the task. Why? Because if you want to rush, if you want to complete everything in that 8 minutes, examiner will get an impression from you that you are not in the objective to make someone learn, but you are in the objective to pass this exam. Okay, so that is not what you want to do in the teaching based station. Your main job here is to make your colleague know about what you are teaching. Okay, so that is the main advantage of identifying the teaching based station. Finally, there is a sixth category called SimMan based station. Here you will see the SimMan inside the cubicle, as simple as that. Now what is SimMan? You can see a photo of a SimMan here. This is a talking mannequin, and it has the signs of life as well. Okay, it has a speaker on his throat so that when you ask something it can speak. If you shine a torchlight on its pupil, then it starts to react. If you take the blood pressure, you can actually get the blood pressure. If you hear the heart or lung sound, you can actually hear the heart or lung sound. You can feel his tummy. You can palpate his femoral pulse. You can palpate his popliteal pulse. You can palpate his dorsalis pedis pulse. You can palpate his tibialis posterior pulse as well. Okay, and more importantly, if it is hooked to a monitor, then the monitor will also show the vital signs. Okay, so this is SimMan. Here, your main job is to not let this SimMan die. Therefore, whenever in PLAB to SIMMAN appears, then these are basically the acute scenarios where you cannot use a real role player. And your job is to solve the problem that always comes in front of you. Problem, solve, move forward. If you are just letting that problem to be solved afterwards, the patient might die in the table as well. So that is about the SIMMAN based station. We'll discuss more into its approach in the later part of our course. Now, let's take this task as an example. You will see a task like this outside the cubicle. It has got 4 parts. Okay, first part, it says where you are. It helps to know your position and your setting. Second part, it says who the patient is. Third part, it gives other information. Fourth part, it says your task. And fifth part, any special note to consider. Now let's discuss the first part. It says where you are. You are FY2 working in orthopedic department. Now what is this FY2? Let me give you the little bit information about the training pathway in UK. After you pass the medical school in the United Kingdom, you will move into the internship. The first year of the internship is also called foundation year 1. Okay, so this can be equivalent to the internship in your home country. Second year is foundation year 2. So they have 2-year long internship, but this is generally equivalent to the first year of house job in your home country. Okay, then after that, you will move on to the core training. So sometimes it can be CT1, CT2, or even sometimes CT3 in some circumstances, in some specialty. Okay, so this is the core training. After that, you'll move into the specialty training like ST3, okay, ST4, 5, 6, even up to 8 in some specialty. Okay, now where is your PLAB2 exam? Your PLAB2 exam is here. You have to act like a first year of a house job or a second year of the internship. You should not be less confident like a FY1 or a medical student, and you should not be overconfident like a CT1, CT2 or CT3 or any other further levels. Now I have seen some of my friends who is dermatologist. They were taking this PLAB2 exam. They got station from skin and they failed it. Why? Because they were acting like a dermatologist. In a PLAB2 exam, you should always be very careful about your position. Your position is FY2. Your position is not as a consultant in the dermatology. Therefore, always act like you are a junior doctor. Okay? So there is a high chance that even if you get the station from your specialty, you might fail this station if you don't act like a FY2. Okay, the other thing is about the department. So give due respect to your setting as well. If you are in a GP, you can't manage a case of a pulmonary embolism in the GP setting. Okay, so maybe your main priority is to send this patient to the hospital as soon as possible so that they can do some assessment and they can start the treatment straight away. Okay, so don't try to show your knowledge on the pulmonary embolism in the management part, but try to manage the situation. Your job is to not manage the disease, but your job is to manage the situation. That's why many candidates are getting less mark in the management part. Now, the second part, who the patient is, it says the patient's particulars like name, age and sex of the patient, and it also says about the symptoms or the complaint of the patient. Okay, other information, it will give extra information regarding this patient. What you must do, it will give you the task, what to do inside the cubicle. Don't do anything more than this. Don't try to be very smart. Do only those things which are given here. Okay, and special note is something that you have to consider if required in some situation. Okay, now dear friends, you are FY2 in the orthopedic department. 25-year-old male Tom presented with a tender right knee due to non-traumatic injury. A final year medical student, David, has seen this patient and taken history. This is his first time seeing a patient with a knee injury and does not know how to examine the knee. What you must do, please examine the patient, show David how to do all the steps of knee examination. Do not ask David to perform the examination. Now, a medical student wants to learn the knee examination and you have to examine and show the David how to do all the steps. So this is teaching based station. This is teaching based station. And you know the advantage of identifying it as a teaching based station. Let's go into the other example. You are FY2 in the general practice. 70-year-old female has been having recurrent falls. Other information is none. Talk to the patient, take history, assess the patient, discuss the plan of the management with the patient. Special note is none. Now, since you have got a symptom here, therefore, this is basically a history-based station. This is basically a history based station, and the advantage is you can do the proper management of the time if you identify it correctly as a history based station in the real exam day. Third example, FY2 in the medicine department, 75-year-old male presented to the hospital with symptoms of pneumonia yesterday. Your consultant decided to give him IV antibiotics, which he has been receiving since admission. He had a CABG, coronary artery bypass graft, a few years ago. His health has been deteriorating in last few years. What you must do, talk to the patient, address his concern. He does not want to continue the antibiotic. Okay, so the main situation here is the diagnosis is pneumonia, and consultant decided to give him IV antibiotics. He does not want to continue the antibiotics. So you can see a dilemma here. Okay, and this is ethical based station. This is ethical based station. Okay, here you will spend your more time in the management part in educating this condition to the patient, and sometime letting the patient know the pros and cons of not starting the antibiotic straight away, and also some time to assess the mental capacity of the patient. Let's take the other example. FY2 working in the medicine department, 53-year-old male had a myocardial infarction. He has been medically managed and is ready for discharge. Medication on the discharge is aspirin, clopidogrel, ramipril, bisoprolol, and simvastatin. Talk to the patient, address his concern, discuss the plan of the management. So you have got a name of the medication, you have got the name of the disease, and you have got the name of the medication, and you have to address his concern. Most probably this is about counseling based station, and you know how to manage the time when it comes to the counseling based station. Alright, so how did you identify it is a counseling based station? Because you have got the name of the medications, name of the disease. Now I shared you earlier as well that if there's a name of a drug, name of a disease, name of a procedure, blood reports are usually long tasks, that is most probably a counseling based station. Let's take the other example. You are FY2 working in the general practice. 30-year-old female had a road traffic accident 1 year ago and sustained a right brachial plexus injury. She can't move her forearm and is here for review. Other information is none. Talk to the patient, take history, assess the patient, perform the relevant examination, and discuss the plan of the management. Special note is none. So maybe you should do 2 to 3 minutes of the history taking regarding what happened, when did it happen, what did you do after that, and any management done. Then maybe 2 to 3 or sometime even 4 minutes in actually performing the examination of the upper limb, okay, trying to assess the brachial plexus. And finally, less than 2 minutes or sometime even 2 minutes in managing this case. Okay, so this is basically a combined examination because it says perform relevant examination. Okay, so this is all about how to know and identify the task and what are the type and format of the stations in the PLAB 2. And I've said you what are the advantages of identifying the task beforehand. Now, there are a lot of things that you can do in the 90 seconds. Okay, of course we'll be discussing more detail regarding that, but one of the things is to identify the task. You might be thinking this might be a very small thing, but this small thing will create a big difference on your exam day. Okay, and hopefully I have made you understand regarding how to identify the task. We'll discuss in the next class in our fourth part of the video regarding how to approach in the history based station, which is 1 out of 6 categories in the PLAB 2 exam. Hopefully I have made few things clear to you. Hope that helps.